Next slide, please. Next, we have a trivia night, which will again be available on Remo. It is a competition centered around this week's conference learning. So I hope you've been keeping your ears and eyes peeled. The winning team will receive discounted registration for the next in-person conference, which is super exciting about the discount and an in-person conference. Next slide, please. For the audience, if you have questions, please populate the Pathable chat box shown here on the by the red arrow. The Zoom chat has been disabled, so please communicate through that Pathable chat platform. And with that, we're ready to hear our poster presentations. So each poster presenter has a pre-recorded video prepared, and we'll be showing that. Following each presentation, we'll have 5 minutes of Q&A with each presenter. Again, put those questions in the Pathable chat and I will monitor those. And we will begin our posters now.
And let me know if there's any issues. Okay.
Hello, everyone. Thank you for joining us today. My name is Alexandra Cassivi, and I'm a postdoctoral fellow at Université Laval in Canada, working on access to drinking water and domestic hygiene in remote communities in the Canadian Arctic. I hold a PhD in civil engineering from the University of Victoria, which I just received last year. And my dissertation focused on monitoring and assessment of access to drinking water in low and middle income countries. I'm happy to be here today and present some research findings from our work in Malawi on behalf of my colleague Elizabeth Haile, Owen Waygood, and Caetano Doria. So as part of my doctoral research project in 2019, just before the pandemic, I have conducted a prospective cohort study in southern Malawi. One specific objective of this research was to improve understanding of households' preferences and practice in accessing and managing domestic water, both in rainy and dry seasons. 3 areas located in urban and rural Malawi were selected through local partner guidance and local community and authority approval, depending on water service levels and geographical components, including population density. A total of 375 households were randomly selected during the first season, and a randomized subsample of 115 households were followed up during the second season, which is the dry season. Households were administered a questionnaire by local enumerators who were also recording observation, including geographical coordinates. Households were asked, among others, about their main source of drinking water and alternative water source, including secondary and tertiary source, where those sources are located, how frequently they are using those sources, how frequently they are fetching water, and why they are choosing this or these source over the other. In addition to the questionnaire, the respondent was also asked to provide a cup of water that a household member would normally drink and to show the source from where the water was collected for sample collection and subsequent water quality testing. Samples of water were taken at 4 different stages of water collection, as you can see here on the picture to your left. So directly from the water source, meaning at the point of collection, from the collection container after being filled, from the storage container, and from a cup of drinking water. So at the point of use, or you can also call it at the point of consumption. Although households rely on improved drinking water source for their main water supply, a larger range of source type were reported being used as secondary and third options. This is the graph that you can see to your right. So more households rely on multiple water sources in urban areas where water source density is generally greater. Yet, the availability is more limited compared to rural areas that mainly rely on boreholes. Results from our study show that households were more likely to rely on multiple water sources during the rainy season compared to the dry season, where more households rely on single water source. source reliability. So we mean functionality and availability, also affordability and proximity to water source, meaning time to collect the water, waiting time, but also distance between the house and the water source, were found to be important factors affecting households' preference towards the use of multiple water sources. Without further ado, I invite you to read our poster to find out how those factors affect access to waters in terms of accessibility, quantity, and quality of water. Overall, results highlight the need to revisit the idea of relying on information collected on the use of a single main water source and consider the extent of alternative available to households without access to water on their premises. Thank you for listening. Do not hesitate to reach out on the conference platform via email or LinkedIn if you have any further questions. Thank you.
Thanks for preparing that, Alexandra. As we wait for some audience questions to trickle in, we can go ahead and get your poster shared to everyone if they wanted to observe with more clarity. Thanks.
Is that okay?
Yeah, that looks great.
Okay, sure.
And again, audience, please go ahead and populate the Pathable chat with your questions or comments. And we have our first from Rick Johnston. So Alexandra, when people would use multiple sources in the rainy season, would those tend to increase or decrease collection time?
Can you hear me?
Yes, we can hear you.
Okay.
Do you need the question repeated?
No, that's okay. Okay, thank you. So what we found is that people are actually going to sources that are actually farther in the rainy season because they have this ability to choose probably the source that they wish to use, compared to the dry season where we found that people are using mainly the sources that are actually available at this time. And so it was actually the closest option in the dry season, but in the rainy season, we found that some people are not using the closest option.
Thank you.
Thanks, Rick.
And we have about 3 minutes for questions for Alexandra. I know that sometimes it can take some time to absorb all the information on these posters. So for the audience members, these posters are all available in the Pathable platform. If you hit the Files tab right above the chat box, you have all the videos available to rewatch, and you have the PDFs of the posters. So we have another question for you, Alexandra. This is from Travis Yates. Were there WASH activities in the area at the time of your research?
Oh, that's a good question. At the time we were there, no, there was no other activity at the same moment that we did this cohort study that we were aware of. So I know that Water for People are doing a lot of activities in this area, in particular in the rural area. But yeah, not necessarily at the same time that we did this.
Thanks, Alexandra. Rick Johnson has a follow-up question for you. So the preferred source used in the dry season was often unavailable in the rainy season. Is that correct? And the additional question is, can you give an example of why that would be? For example, piped water or borehole water may be less reliable during the rainy season.
Yeah, so what we found is that people were saying a lot of times that sources were actually broken. And this is also something that we did observe when we were there, because as I explained before, we did sample the water source as well. And sometimes we asked the participants to go to the water source and it was actually not working at the time. So that was something that we could observe ourselves too. So yeah, a lot of time those water sources are not necessarily available, but what we found in Malawi is that there's actually a great amount of source in terms of number of source, and they are quite close to the households. It's just that, yeah, the sources that are not working is actually a big problem.
Thanks, Alexandra. We have time for one more question at about a minute. And it doesn't look like we have any immediately, but for the audience, if you have more questions that come up later, please either put them in the chat box or you can reach out directly to the presenter.
Yeah.
Thanks, Alexandra. So Manal, I think we are ready to move on to our next poster.
All right.
Bear with us for 1 second. So up next, we have a poster by Mona Fetouh.
Hello, everyone, and thank you for joining this session on the evaluation synthesis of UN System and Development Bank work toward SDG 6. My name is Mona Fetouh. I am from the UNICEF Evaluation Office in New York, and this work was led by Travis Yates of Tufts University and also involved Anna Murray of Charity Water. The synthesis was recently completed and it was led by UNICEF, but it involved a reference group of 9 other UN agencies as well as the World Bank. So it was a very collaborative process, which really helped strengthen the final report. So as many of you know, at current rates of progress, SDG 6 targets will not be achieved by 2030. So as we're 5 or 6 years into the 2030 agenda, we wanted to look at evaluations conducted of SDG 6 related interventions since 2015 by our UN and Development Bank partners. And the purpose was to take stock of what's been achieved to date, identify facilitating factors and challenges, and inform a path forward on what remains to be done. Of course, there are significant monitoring efforts ongoing, as we all know, such as the JMP, but there's been little done to look comprehensively about what evaluations say about SDG 6 results. So this synthesis was intended to fill that gap. The synthesis took place in 2 phases. Starting with a mapping phase and followed by a synthesis phase. The mapping began with the initial search and screening. You can see the inclusion criteria here. And in total, 90 evaluation reports were screened in. We then mapped evaluation coverage and found that there was coverage of 79 countries as well as the global and regional levels, with Africa and Europe and Central Asia being the most evaluated regions. Evaluations came from 11 entities, with most coming from UNDP and UNICEF. And interestingly, humanitarian settings had less coverage, only about 24%. Most evaluations were conducted in a development context. When it came to target coverage, integrated water resource management, 6.5, 6.1 on water and 6.2 on sanitation and hand washing had the highest number of evaluations, whereas target 6.3 was the least covered. And as you can see, most evaluations, 79%, actually covered more than one SDG 6 target. There was quite a bit of overlap, as you can see from this chart here. So the second phase of this work was the actual synthesis of findings and recommendations from the included report. The 3 primary research questions are here, and they focus on effectiveness. And there were 6 other secondary research questions, which looked at other OECD DAC evaluation criteria, such as relevance and sustainability. So for the synthesis, we learned a number of different interesting lessons. The majority of reviewed evaluations rated SDG 6 as mostly or highly effective, particularly where strong coordination and strong monitoring and evaluation were in place. But this also raises the question of why we're still falling behind. So the synthesis noted that increased levels of innovation and in particular increased scale up are necessary to fill those gaps. Another key finding was the need to have expanded, more inclusive, and more meaningful stakeholder engagement, particularly with local actors. And on the sustainability front, that was actually the most poorly assessed area, with about half of projects projected to be unsustainable. So this raises the question of being sure that the push toward acceleration, which is very much needed, doesn't overshadow sustainability concerns. The report made a number of recommendations aimed at both program and evaluation units to address these gaps, and the involved agencies are discussing now how to implement these. And this is just a very quick summary, but many more details are included in the full report, which I will link here. And I wanted to thank you all and look forward to your questions and comments.
Thanks for preparing that presentation, Mona. If we could get you to share your screen right now so we could all see that poster with a bit more clarity. And I see that Mona has linked the report in the chat box. Thanks. So we can see it great now, Mona. And as we wait for some questions to come in, I have some clarifying questions because obviously SDG 6 covers a lot of grounds. I think you briefly glossed over some of the inclusion criteria. Could you just maybe zoom in and perhaps clarify if there is anything, that's maybe vague on this? I just can't, it might just be me, or is it difficult to zoom in? And you're muted right now, Mona.
Okay, it wasn't allowing me to unmute myself, but
perfect. We're good.
Sure. So the inclusion criteria, I mean, it was quite broad. So I really covered anything related to SDG 6 interventions that were conducted by either UN entities or development bank partners. The date inclusion criteria noted here was evaluations completed since 2015. But that actually presented a bit of a challenge during the synthesis because, of course, evaluations conducted in 2015 are often of work that predated the SDG era. So, so we had developed some criteria in terms of the percentage of the project being evaluated that took place within the SDG era, and also expanded to 2014 to cover transition activities. And the other main point to note is that it was only evaluation reports included. So reviews or after action reviews or other types of assessments that didn't meet evaluation criteria were not included. And that was to ensure that the evidence base was robust. But it did, of course, decrease the number of reports that we would have looked at in a more inclusive review. So hopefully that answers your question. I don't know if you have any follow-ups. Oh, there's also a quality rating criteria. So if they had been rated already as satisfactory or higher, then they were included. And if not, then the team themselves conducted their own quality review of each report based on the bond checklist. And I should note that the lead researcher, Travis, is online with us today as well.
Thanks, Mona. And hi, Travis. While we wait for some more audience questions, I have another clarifying question. I heard at the end of that presentation, you mentioned sustainability as an issue. Could you define that in this context? Just because for me as like a trained environmental engineer, that word means something different for me, and I'm sure for many others.
So essentially that's looking at whether projects are likely to be sustained in the medium to long term. And it was up to each evaluation report to determine what sustainability criteria were. So we were essentially going by how each report defined sustainability. We didn't have our own definition of what it means, but generally how it's understood is would these activities be able to continue once external project funding, for example, is removed? Are national capacities up to task in order to take over the project and to take over financing? So that's generally how it's assumed, but as mentioned, it was different for each project.
Gotcha. Thanks, Mona. And we have about 2 minutes left for Q&A. for those of us for those who joined late, audience members, please put all questions in the chat box in Pathable. We have less than 2 minutes for questions, but I'm sure questions will develop later, as they tend to for myself at least. So please continue to put your questions in Pathable, or you can reach out directly to the poster presenters. And again, all posters are included in the Files tab in Pathable if you wanted to download and zoom in. I think since we have no questions and we're at this 1 minute mark, we can proceed with the next presentation. So thanks again, Mona, and for Travis for joining and clarifying some of those questions. And up next, we have a poster by Naziano Filizola.
Hello, my name is Naziano Filizola. I am from the Federal University of Amazonas in Manaus, and I'm going to present this poster with the title Hydrometeorological Variables and Malaria Incidence in the Brazilian Amazon. Malaria is a potentially fatal disease caused by parasites of the genus Plasmodium, which are transmitted to humans by the infected female of the Anopheles mosquito. The main goal of this job is to identify malaria relationship of annual parasites incidence index, the API, against fluctuation in river levels, suspended sediment concentration, and precipitation. Well, we did the test in 2 Brazilian states, I mean the Amazonas state and the Pará state. We also did the test with a river, a black river, this is the Negro, and a clear river, the Tapajós, here at the site of Itaituba. And we also did at whitewater rivers, I mean the Amazonas itself at the site of Manacapuru, and left side of the Amazon tributary, which means the Puru River at Beruri. The results are here, where you can see in red the API line and results for each month in a normalized way. We also have in clear blue the river level. We have in high blue the precipitation, and in brown we have the suspended sediment concentration. Which is very interesting is that for the white water rivers, we have spatial behavior where when we have lower suspended sediment we have higher API. It happens both in Manacapuru and Beruri, but we don't have the same signal for the Black River and the Clear River, which stations have lower suspended sediment concentration. Another interesting is that we have almost the same signal, the opposition between API and precipitation for Manacapuru and Beruri, a little bit of the same signal for Santa Isabel do Rio Negro and for Itaituba. And we also have here the peak of river level at Manacapuru, Beruri, and especially Itaituba. There is a delay with the peak of API. We did this work using data from 2005 until 2013. And here you can see the correlationship between those variables for each one of these years. And as preliminary conclusions, you can see that seasonal variability of rainfall and the level of rivers influence the seasonality of malaria. In addition, the disease is more intense in place of periods of low suspended sediment concentration, showing that this may be a favorable condition for the development of the malaria cycle. Thank you very much and have a nice day.
Thanks for preparing that, Naziano. If we could just get you to share your screen with that poster. Oh, so we see your desktop right now. Perfect. There's a lot of material on this. And as we wait for some audience questions to trickle in, Naziano, was there ever a concern that there are factors aside from rainfall that may have been correlated with some of these malaria incidents that you were looking at?
You mean that the correlation is strongest than the others? That's it? In fact, can you hear me?
Yes.
Okay. So as we can observe in this figure, we have most in the whitewater rivers an opposition of phase between the API and the rainfall, right? So we have to say that the northwest part of the basin, of the Amazon basin, is the part of the basin which we have more rain. So normally there is a high APA as well, but we don't see this correlation or so strong for the black water rivers. That's it. I'm not sure if I will understand.
It was a question for clarification, which you provided.
Okay.
So thank you.
Okay, so.
And we have one question from Rosa. They say, I may have missed it, but how many observations did you have? 1 year or more than 1 year? Were they largely complete daily or monthly observations, etc.?
Okay, so for river levels, we have daily observations. For rain, we also have daily observations. For suspended sediment, we have 4 times a year observations. And for the API, we have daily observations, but we put all together in a monthly basis, right? And this observation from those from 2005 until 2013.
Thank you, Naziano. And we have time for 1 or 2 more questions. If they come later, please reach out directly to Naziano or place your question in the chat box. Manal, I think we could go ahead and put up our next poster while we wait for more. Thanks again, Naziano.
Thank you too.
Hi, everyone. My name is Becky Kann. I am currently a first-year PhD student at University of Washington, but today I will be presenting the work I contributed to as a graduate student in the Freeman Research Group at Emory University. The work was titled Quantifying Factors Associated with Personal Hygiene as Measured by the qPHAT Methodology, which was a sub-study of the Andilaye Trial in Ethiopia. WASH interventions often target improvements to personal hygiene behaviors in order to reduce the transmission of infectious diseases. However, such programs often confront challenges in being able to accurately measure personal hygiene behaviors. The goal of this research was to compare the utility of 2 different types of hygiene outcome measures in their ability to detect relationships with WASH-related conditions and behaviors. We used hygiene and behavioral data from the Andilaye Trial, which was an impact evaluation of a wash intervention implemented in Amhara, Ethiopia. We compared the hygiene outcome data for both hand and facial cleanliness collected via the novel quantitative personal hygiene assessment tool, or qPHAT, to those generated via conventional dichotomous hygiene outcome measures. The qPHAT metric yields objective measures of cleanliness on an 11-point color scale, which is shown here on the upper left. As for our methods, we fit multivariable regression models to evaluate associations between measures of facial and hand cleanliness and household wash conditions, psychosocial factors, and reported personal hygiene practices using cross-sectional end-line data from the Andilaye Trial. We also used generalized estimating equations with robust standard errors to account for clustering at the community level. The diagram here on the left shows a summarized theory of change that was used to develop the models for this study. The research was really split into two parts. First, in analyzing behaviors for facial cleanliness, and second, in analyzing behaviors for hand cleanliness. For each, we analyzed and compared 3 different outcome measures, which were defined in detail here on the bottom left, with the overall goal of comparing the qPHAT metric to different types of dichotomous indicators. The results from this study are shown here in the diagrams in the middle. The different outcome measures are reflected by the different shapes, and the significant findings are highlighted in red. Our first key finding was that the qPHAT metric was able to detect several associations between conditions and behaviors for hygiene and cleanliness outcomes. Specifically, based on qPHAT scores, higher levels of water insecurity were associated with both dirtier hands and dirtier faces. And additionally, the qPHAT metric was able to detect several associations between psychosocial factors and hand and facial cleanliness outcomes. Dichotomous indicators, on the other hand, detected fewer of these relationships. Our other key finding from this research is that there was a negative association between qPHAT scores for facial cleanliness and reported face washing practices. In other words, households that indicated they had washed their child's faces within the day of the survey, either with water or soap and water, were more likely to have children that with dirtier faces compared to those that reported they didn't wash their child's face. This suggests that there may have been over-reporting of hygiene practices and highlights a potential analytical utility of the qPHAT metric in being able to detect this potential bias. Overall, our study highlights the limitations of proxy indicators of hygiene practices, including both reported practices and dichotomous indicators of hygiene, and suggests that the novel qPHAT metric yields more granular data on hygiene outcomes. We further conclude that using more nuanced hygiene outcome measures, such as those generated by qPHAT, may reveal important intermediate factors that influence the hygiene behavior and further clarify pathways of behavior change. Thank you all for your time, and I'm happy to take any questions.
Thanks for preparing that, Rebecca. And if we could just ask that you share that poster right now, that would be great. Looks good. Thanks. And for audience members, please put any questions you may have directly in Pathable. And while we wait for some of those, we don't have to ask my question. So Fred has asked our first question. He says, thanks for the qPHAT technology. Exciting that I'm going to start using it in the next few days. I'd like to understand the method used to quantify dirt other than using personal eyes. Could you have assessed its efficacy before appropriate hand hygiene? On a scale of 1 to 10, what level is acceptable to use alcohol-based hand sanitizers? ABHR has not been recommended for visibly soiled hands.
Thank you. Yeah, that's a great question. So I'll start, I think, with just that the qPHAT methodology, the reliability study of this qPHAT methodology was embedded within the Andilaye trial, and that's what we used. That's the data that we used for this analysis. And so in assessing the qPHAT method, we do know that it was reliable in this setting and that there was intra-rater reliability. And so in terms of if there's a method used to quantify the dirt other than personal eyes. Within that reliability study, another method that was used to quantify the level of dirt was densatometry. And so using software that can detect the amount of, or the level of light that was present in the picture. And so that's another way that was tested to look at the quantification of dirt in this. And so that's something also that could be used for this method. On this, in terms of your question for using alcohol-based hand sanitizers, I don't necessarily have the answer for you for that, just because that wasn't necessarily studied in the reliability assessment. But we, I think, are hoping to continue to look at the qPHAT method. And there are future planned studies in looking at the validation or doing a validation study of the qPHAT method to understand if it is a valid metric for detecting recent hand cleanliness practices, as well as if it's a valid metric to detect disease prevalence or incidence.
Thanks, Rebecca. We have about 3 minutes left for questions. While we wait for some more questions to come in, I have some questions about possibly other things that were captured. Well, I guess that's my question. Were other things measured, maybe like some symptomology or any other health indicators captured? And I guess the broader question would be, what are your next steps or future plans for this research?
Yeah, I think in terms of for this specific analysis, we were really only looking at that hygiene outcome. As part of the Andilaye study, there were other metrics that were captured, or there were other outcomes that were captured, including mental well-being outcome scores. But specifically in this analysis of that data, we were just looking at those hygiene outcomes. And for future work for this study, I think our main goal is to look at these relationships on a longitudinal scale. So this is really looking at the cross-sectional scale and just looking at that end line data from the intervention. But we're hoping to also look at the changes from the baseline to end line, which is a 2-year change or a 2-year time difference. And so looking at if these different metrics, how well they're able to detect those changes in hygiene behaviors as well as hygiene outcomes.
Thanks, Rebecca. And we have another 1.5 minutes for questions. So one more question from the audience. I'll refrain from asking mine for a couple more seconds. And I'll ask mine now. So I'm curious if you captured anything else that could have been related to what you're seeing in this qPHAT color scale, like if some things tend to be darker than other things, but maybe riskier, like how did you were there any considerations made in possibly the interpretation of this qPHAT color scale?
I guess in terms of the relationships with hygiene behaviors that we were seeing, is that your question?
I guess my question, well, yeah, well, no, that my question is it possible that there are some possibly hygiene behaviors that would make hands and faces darker than others, but would not necessarily suggest something to be dirtier? Does that make sense?
Yeah, that's a good question. And I don't know if I have the answer for that, just because I don't know if we had the data specifically to look into that question. Really, this data was just looking at, if, for example, someone was reporting a certain level of water insecurity, what was that relationship with then these hygiene outcomes based on the color scale? We weren't necessarily looking at what that color scale was detecting or what kind of dirt it was detecting or anything like that. But that's a good question for potentially future work into this.
Thanks, Rebecca. I feel like I gobbled up a lot of that Q&A. But for the audience, if you have more questions for Rebecca or for any of the other posters that you've seen today, this chat will continue to remain live. And For the presenters, please make sure that you continue to look at that, because I see at least one more question that an audience member has given to Naziano. But with that, since we have no more questions, we're 3 minutes ahead of time. We'll give you 3 minutes of your life back. Thanks again to all the people who've prepared presentations and answered questions. I hope you enjoy the rest of the conference. Bye.
Thank you, Amanda.
Thanks, everyone.